Hello everyone, myself Dr. Rushikesh Kushalrao Lahane. Today we are going to discuss a very important topic, management of oroantral communication and fistula and various surgical options for it. Coming to major sinuses that are frontal sinus, sphenoidal sinus, ethmoidal air cell and maxillary sinus, as we all know about it. In this topic, the oroantral fistula communication is always associated with maxillary sinus. So, what is oroantral fistula? It is an epithelialized pathological unnatural communication between oral cavity and maxillary sinus. It develops when oroantral communication failed to close spontaneously and remain patent and it get epithelialized. There is migration of epithelium into defect and spontaneous healing is hampered, which may result in chronic fistulous tract as we can see in the image, and it required time of 7 to 8 days to become chronic fistulous tract. Coming to etiology, there are two types of etiology, major and minor etiology. Major etiology include anatomical proximity or projection of the root of molars, especially maxillary first molar, and minor are maxillary tuberosity fracture, implant dislodgement, osteoradionecrosis, flap necrosis, complication of Caldwell-Luck operation. You can also classify etiology into these three topics. Coming to classification of oroantral fistula, it is mainly divided into three types: alveolo-sinusal, palato-sinusal and vestibulo-sinusal. This classification is based on anatomical landmark, as we can see in the pictures. Coming to diagnosis, how we can diagnose it? By nasal regurgitation, altered nasal resonance, difficulty in sucking through straw, unilateral nasal discharge is there, bad taste in mouth, whistling sound while speaking. These are the diagnostic tests which we can detect that the patient have oroantral communication. Coming to treatment plan, 50% of the patients show healing within 48 hours only, but 90% cases show within 2 weeks, and as we all know, it happened by secondary healing. Means the oroantral communication healed by secondary clot formation. If healing not occur, then irrigate with normal saline and iodide solution. After that, we can go for surgical approach. Most common surgical approach is buccal advancement flap and palatal flap. Other are submucosal tissue flap, bone autograft, buccal fat pad. Now we can see in the pictures the palatal flap is reflected and close it over the communication. After that, we suture it. In the second picture, we can clearly see the buccal advancement flap. We cut it, we stretch it over the oroantral communication and we suture it. After that, post-operative management is very important. So, not to eat hard food, drink from opposite side, not to do strenuous physical activity. Patient should open mouth while sneezing and coughing to reduce the tension over the suture. Use of straw or smoking is prohibited. Along with this, patient should take Amox plus clavulanic acid 1 gram twice daily and decongestant as a nasal drop or Trivin 0.05%. It helps in shrink the nasal mucosa and keep the antral opening patent. NSAID for pain control. These are the precautions we should take after the surgical approach.